Historically, cholera is one of the most significant human diseases over time. It had been primarily Asian-based through probably the 19th century, and then as people started becoming more interconnected, we had the first, what's now called the first global pandemic, and so that was in the early 19th century. And there's been multiple ones since then.
I think under the best of times, which was probably in the 1980s, only about 50% of the population of Haiti had good access to clean drinking water. And that doesn't mean water to their house. It just means access to clean drinking water. And in the 80s, probably maybe 30% of the population had access to sanitation that actually protected the water quality. So by that I mean septic systems or latrines that were positioned far enough away from water supplies so as not to contaminate them. So that's deteriorated since the 80s. The 80s were probably the best of times. And then there were government upheavals, and systems that were put in place in the 80s were not maintained. There are a lot of alternatives. One of the things that's being used are just slow sand filters and these were used in Europe way long ago, back in the 1800s, and they're really quite effective. They're just slow. But they're being put in place for surface treatment of waste in some places, or at least they're exploring these ideas. They require very little maintenance, and the maintenance that is required can be carried out just with labor and sand, basically. A nice, there was a German word for it, which I can't remember, but a nice growth of bacteria, et cetera, on the top of the sand over time actually does more than just filter. It pulls waste out of the liquid, as well as filtering the biological growth does.
It seems like Haiti is just kind of viewed, especially in the Western Hemisphere, as kind of like the needy child that needs so much, and you just pour so many resources, and you have all these different organizations coming and giving and giving and giving, and nobody has any dignity of giving something back. It seems like if there were some way, and I know in the midst of a disaster like this, I don't know how you would breed this, but if there was some way where the Haitians had some sort of ownership or something that they were bringing to the table. And even the idea of voodoo, Paul Farmer lays it out pretty well, where one of his patients, he says something about voodoo, and she said, "Don't you know that it's both? It's both it's both medicine and science, and it's voodoo. Like for them, there's not a separation there of those realities."
The idea of the community contributing is something that Engineers Without Borders is really stressing a lot. And when we go into a new project, really talking with the people, seeing what they see as their needs is important. And then as you start to address those needs, the second part of it is keeping them involved and helping them come up with a system that they can use to maintain this over time, so that they are contributing to it, they are giving to it, and they are establishing ownership of it. So there is an awareness that needs to happen, but as you said, in a situation like this, where you've got so much to deal with at one time, it's hard to know where to start.
People learned over time you need certain water systems and disposal systems, are critical. But when you have developments, every time here, if somebody wants to build another add-on to a city, the first thing that goes in is the sewers and the water and the electrical, goes in. Whereas there, it happens, and then you go, oops, we need some water, you got to figure out how to do it. So it's much more, those informal settlements become that way. And then you run into it, and we see this in Zambia, there's huge populations that are there, and there's certain times a year, depending on who gets hit with the rains, when all of a sudden water is up 16, 18 inches, people are sandbagging around their houses, and so there's not even basic. You could put cholera in that setting in a second, and it would explode. That would be another place where it's ready to happen. There's big piles of stuff all over the place. In fact, one of the big problems with water right now is there have been big efforts to clean up what would be the normal drainage in a lot of places, but the problem is they start cleaning them up at the top. So they're moving down, they get almost to the bottom, and but then the last half mile, it's what's all clogged up, and that's where the biggest stuff is. And no one's addressed that. So when the floods came, that's when everything overflowed and went off in all directions again. So instead of doing it from the bottom up, it was from the top down, because it was easier to get to.
I think in this case, at least the parts that I've been reading, there were a lot of NGOs already in that had a footprint in Haiti, and people try to connect with them even outside when the resources were being channeled in. They were trying to channel them into NGOs. But NGOs, remember, I mean, they usually are taking one particular issue, working at it that way. It doesn't help you with overall systems. You know, I've seen this in Zambia with the health system. None of it is health system strengthening. There's certainly a lot of emphasis on health care and food distribution, you know, when the crisis first happened. But what's happened subsequently is because there's been so much resources put in, it's actually disrupted the whole agricultural economy of the country. That people who were growing up in the rural areas and bringing stuff into the city no longer have markets because there's been so much stuff that's been brought in. And the same thing, people who are making a living as practitioners in the area don't have practices anymore because of all these free health clinics that have been set up. So it doesn't help. So the NGOs were there. They're doing what they wanted to do, but it doesn't. So someone, you know, to pull that back and say, look, we've got to get the system strengthened over time becomes an issue.
The whole nursing situation in Zambia, training, there was a real lack of training for nurses, and that wasn't coordinated in any sort of way. And so she was able to kind of start there, right, and get a protocol in place. This is how we want to train nurses, and build from there so that now nurses are being trained so that they know what they need to know. And so that's going to sustain the system rather than people just keep coming in from outside and helping.